agency and for the state. But now we have someone new coming, and her name is Eunice Medina, and she is a real pro, and she has agreed to take the job, and she's been working under his tutelage now for 3.5 years. And I'll tell you a little about her before she gets a chance to speak. And I think it's about 22 years that she's been doing this. And she started in Florida, went to school there, and got a bachelor's degree in, what was it? Spanish and International Affairs, which of course fits right into this job. But let's see, Florida Department of Elder Affairs, she's there for 10 years and 10 months. She supervised this and that, community waivers. There are a lot of technical data here that is probably not familiar to most people, but what it means is that she has been around every aspect of this kind of work for her entire career. She was there for, as I said, 10 years, 10 months, then went to the Florida Agency for Healthcare Administration for 7 years and 1 month, and there she managed all sorts of plan management operations, managed 60 people, Medicaid, managed care contracts, marketing, provider network, subcontractor oversight, and then of course came up and has been here with us at the Department of Health and Human Services for 3.5 years working under Robbie Kerr, who's done a magnificent job, and this was his second time being here. As you know, he came back to serve his state again, and she has been at his right hand and making great progress, for which we are very, very thankful, and we're delighted that she has agreed to accept this challenge, this responsibility. So with that, President Thomas Alexander will provide remarks, and then we'll go to Speaker Smith, Senator Verdon, and keep going. Oh, you want to provide? Go ahead.
Yeah. Thank you for that introduction, Governor McMaster. I am truly humbled and honored to be standing with you guys today. For the last 20 years, I have dedicated my career to working in Medicaid. For 3.5 of those years, as the governor stated, I've had the pleasure to serve alongside the former Director Kerr. I could not have had a better role model or mentor. I've had the opportunity to work closely with him to set a new strategic direction for the South Carolina Department of Health and Human Services. We have worked hard to keep the talented staff we have at the agency, evaluated where we needed additional capacity and expertise, and hired for those positions. This has allowed the agency to be better stewards of taxpayer funds by better accessing, analyzing, and acting on the data needed to make sound decisions. This approach has helped inform some of our historic work over the last couple of years to ensure Healthy Connection Medicaid members have access to services. During that time, we have overhauled the state's school-based mental health program, which has doubled the number of mental health counselors available to students. We've streamlined Medicaid preferred drug lists to a single state-directed list, which we project will save the state more than $21 million each year. Invested more than $150 million in state funds in behavioral health infrastructure to build additional capacity across the state. We've improved access to services with targeted reimbursement rate increases for providers and added coverage for more than 10 new community-based behavioral health services. This is a list of accomplishments every South Carolinian should be proud of, and it brings me to where we are today and my vision for where to take this agency. At its core, the agency's role is to purchase access to healthcare services for the most vulnerable individuals in our state. The Medicaid program currently serves approximately 60% of the state's children and about 60% of births. Additionally, a significant number of South Carolinians with disability are enrolled in the program. Given this large footprint, we have a responsibility to these individuals in Medicaid to better streamline how services are accessed. We can do this by continuing to support our disability community by not only investing in those who provide care, but also funding more slots for Medicaid waiver programs to allow more people to receive care in their community. continuing to evaluate behavioral health services to ensure we have access to the right care in the right setting, enhancing case management and care coordination to make it easier for families to navigate the health system, investing in the state's future physician workforce, continuing to work with a dedicated and talented team at HHS to ensure we have well-trained workforce with the resources they need to carry out our mission to be boldly innovative in improving the health and quality of life for South Carolinians, and continuing to collaborate and work with our partners in the community, other state agencies, and families to find more efficient ways to improve outcomes for our citizens in need. Thank you again, Governor McMaster, for the faith you have shown in me by nominating me for this position. I look forward to earning this position through the confirmation process. Thank you.
Thank you. Senate President Thomas Alexander.
Thank you, Governor. It's a pleasure to be here this afternoon, and thank you for your nomination of Eunice for the HHS Director. I think after you just heard her comments, you can understand why we're standing here today, to have someone of her caliber that's willing to step up. Former Director Kerr, it's hard to say former director, but former Director Kerr has served our state with great distinction, not once, but twice in this role, and really has assembled a team and had a vision for the future of the agency. And to bring Eunice up 3.5 years ago from Florida, and my opportunity of visiting and meeting with her, and as you could hear from these comments today, she knows the program. She knows what it's about. She cares about serving the citizens of our state that need the services, and we're fortunate to have someone of her caliber willing to step up and be a part of the team here, of Team South Carolina. I sense, and I think you could sense that as well, she has a heart of service, of putting those citizens that need those services first and foremost, but at the same time being a protector of the taxpayers' dollars here in South Carolina. So I look forward to working with you in your new role once you go through the Senate process of Senate confirmation, but I'm delighted to be here today to participate in this event for your nomination to be the next HHS Director for the great state of South Carolina. Thank you.
Speaker Merle Smith.
Thank you, Governor. It's a pleasure for me to be here today to be a part of this selection process for Eunice Medina. Let me first, Governor, thank you for what you do. The governor, as everyone knows, demands quality directors throughout his agencies and his cabinets. And I can tell you, I was part of it, and of the selection of Robbie Kerr. I guess it's 3.5, 4 years ago. Seems like it was yesterday we were sitting out here, ex-Director Kerr, former Director Kerr. But the way that process worked through the governor's collaboration was he put together a team. And former Director Kerr did not apply for the job. He was drafted for the job. And unfortunately, when the governor asked, he didn't say no, but he had conditions. And one of those conditions was that I have to build a team, a leadership team behind me that I can trust will be able to run this agency. And that he has. And he brought Eunice back, as you heard, and has worked under him for the last 3.5 years and worked collaboratively with him. This is going to be a seamless transition at HHS. And right now, HHS has a lot of responsibility and a lot of other issues that they have to deal with, but under Director Kerr and Eunice's leadership, they have tackled those and made it one most efficient in my 24 years of serving, the most solvent that we have seen throughout these years. And as you heard from Eunice, you see that she is prepared to continue that same tack that they have practiced over the past few years of making sure that's transparent. It serves the needs of the most vulnerable in South Carolina, and I cannot think of anyone that's better to do this job. So I wish you much luck through it. Wish you luck through the Senate confirmation. Fortunately, those of us in the House do not have to be involved in that, so thank goodness. But I have every confidence you will have a lot of success there. So congratulations.
Senator Danny Burton.
Thank you, Governor, and thank you, Governor. Let me also add my thanks and commendation for the selection of Eunice Medina as your choice and pick for the administration and leadership as Director of Health and Human Services. I'm recollecting, Mr. Speaker, the confirmation, Mr. President, we enjoyed of Director Kerr just a few years back. I remember specifically someone saying, well, Director, if you're half as good as you were on your first stint as we expect you might be in your second stint, there's certainly great things in store for South Carolina at Health and Human Services. I was reminding Robbie of that earlier in the month, and he said, well, if you liked me then and continue to like me now, you're going to love Eunice. And back to that building a team, you know, I think that the continuity of leadership with the agency actually let the cat out of the bag. I think we're maybe going to have witness to maybe the power behind the throne, or the brains of the operation, so to speak. So, in my experiences with Eunice Medina, I am again so confirmed of her willingness to bring the energy and the heart and soul to a critical aspect of, you know, are we loving our neighbors? Are we serving our neighbors here in South Carolina? You know, this CMS interface and this Medicaid program is vital and integral to the quality of life and the well-being of so many of our citizens, and we look forward to the confirmation process. Mr. President, we're privileged to have the senior leadership of the Senate on the Medical Affairs Committee, so we're certainly looking forward. Governor, as I've already alerted the clerk, as soon as we have the nomination in hand, we will be looking forward to making this the first order of business for the committee this year. So we're looking forward to an efficient and expedited process and a productive confirmation. Thank you.
Director Robbie Kerr.
Thank you, Governor. Well, it's been an honor and a privilege to have served in your administration, and I want to thank you for your leadership. I have valued your insight and your determination, your friendship, but most of all, your devotion to the people of South Carolina. About 4 years ago, you asked me to be bold in serving the citizens, and you said, go build a bench at HHS. Well, with your vision and guidance, I think we've accomplished just that, and we've effected transformational change. The agency has developed a culture of commitment to purpose. It's implemented sound long-term planning processes and cultivated a leadership team that I believe is unparalleled in South Carolina. I'm a little biased, but I think you'll agree with me once you see it in action. And there's no one more prepared or better equipped than Eunice Medina to lead that team. Her extraordinary knowledge, her dedication to service, her values will serve South Carolina well. I have complete confidence in her and her leadership team at HHS, and I look forward to seeing what y'all accomplish in the years to come, because I'm sure it's going to be great. Governor, again, President Alexander, Speaker Smith, Chairman Burden, thank you for the confidence you placed in me all these years. I am grateful for your trust and the shared love and devotion that each of you have for our great state. I wish you Godspeed and his blessings in your continued efforts and service to South Carolina. Thank you.
Thank you, Robbie. Thank you very much. Okay. Does anyone have any questions? We could do that now, later. We could do it off topic later. Questions? You got some talent up here if you got some questions.
Mental health is always such a hot issue. It's something that seems to become more important as time goes by. I know the state has invested heavily in behavioral health. What does the future of that look like for South Carolina?
We need to invest more. We need to be smart. We need to look way in the future. Behavioral health, mental health, physical health, all those things hold us back. and we've got a lot of work to do. Our people have the culture, they have the character, they have all they need for great success, but they are limited by these deficiencies, and we must, that's the main thing we do, is keep them safe, get them educated, keep them healthy, and allow them to work. And when that happens, that's why you have businesses, leaders from all over the world that want to come in here and invest hundreds of millions and billions of dollars in our people. But if they're sick or they have problems that can be eliminated, that makes us a better place. That's what it's all about. Any more questions? Hearing none, thank you very much. Congratulations.